Hello, I'm Guy Garino, and I'm the Chief Development Officer here at Catawba Valley Health System. And we are here tonight to thank you for your continued support of our mission. This past year, we raised over $1.4 million through the foundation, including over $100,000 from our employees. We had another successful Casino Royale event last September, and we are working hard to establish our Legacy Society, the future of the hospital. It is a pleasure to do my job, and I'm very excited to be able to share some of the stories that were made possible by your contributions this past year. Thank you.
Hello, I'm Maria Pinto, one of the social workers here at Catawba Valley Medical Center, and I just wanted to tell you a little bit about our Good Samaritan Closet. We started this closet 3 years ago, and the social workers here are able to go to that closet for medical equipment, funding, whatever some of our indigent patients or just patients with dire needs. That's just a place where we can go to help them out. I know you'd probably like to hear a story. Patty has one that was very heartwarming, so.
Thank you. My name is Patty Weatherford. I'm Family Care Coordinator for the Cancer Center here at Catawba Valley Medical Center. And we have a patient who was in need of transportation. He was double amputee in a motorized wheelchair, and he would come to the hospital here in infusion for lab work and for radiation treatment 5 days a week. When he and his wife had a van, that they had a motor vehicle accident, the van was not able to be used any longer to transport him, and so his insurance didn't allow for any transportation. They did not have funding to be able to arrange for transportation, and so he would not be able to get here to get his medical needs met. So through the closet, we were able to fund for transportation for him, and he was able to be here 5 days a week and get his treatments, receive his infusion, and was able to help sustain him in his medical needs. So we thank the closet. Without that, he would not have been able to have gotten here. So we thank you.
I'm Lori Joplin. I'm the Director of Pulmonary Services at Catawba Valley Medical Center. I've been in my role here for 9 months, and upon arrival, I realized that we had an opportunity to improve practice, both for our patients and our staff here at the hospital. I spoke with my Vice President, Sherry Richardson, who sent me to the foundation. And I've never worked with a foundation, but I've worked with Tracy in the foundation to explain a need that would allow patients to hopefully avoid the need to be placed on the mechanical ventilator, which is a tube in your throat. You would not be able to talk to us. You would require sedation. It requires you to wean from that process. So I engaged the foundation to help support us in the investigation of the Vapotherm. The Vapotherm allows us to provide higher oxygen flows and concentrations through the same device that you see patients walking around the shopping mall with. It's a simple nasal cannula that goes into the patient's nose. But with the Vapotherm, it enables us to have a higher oxygen requirement and flow requirement that supports them through the time when they might require additional support with their breathing. From a facility perspective, we want to reduce readmissions, we want to reduce admission to critical care beds, and we want to shorten patients' length of stay.
I'm Mindy Street. I'm a frontline clinician here at Catawba Valley Medical Center. I'm here today to talk to you about the Vapotherm and my experience with patients here at the hospital. One of my first experiences was a patient coming in the ED, tripod breathing, can't breathe, just, air hungry. Instead of putting them straight on a BiPAP machine with a mask strapped to their face, I was able to go straight for this nasal cannula, which was very easy and comfortable for them, but also supporting them enough that I could avoid mechanical ventilation or putting an endotracheal tube down their throat. When you think about having to use a BiPAP machine when you already can't breathe, and that's strapping a mask to someone's face and blowing forceful air. The best example is you driving down Interstate 40 at 70 miles per hour and sticking your head out your window. That's pretty much how it feels when you first put the mask on a patient's face and they're already struggling to breathe. So it's very scary for them and not comfortable at all. So instead you can use just this little nasal cannula. The other experiences I've had with this is extubation for terminal illness for end of life. This allowed my patient to be able to say last words to their family, the family to be able to say last words to them without having a mask strapped to their face or endotracheal tube where they couldn't talk to each other. So it was just a good transition for patient comfort and family comfort for end of life.
I'd like to take this opportunity to express my appreciation and my staff's appreciation for supporting us.
Hello, I'm Honey Estrada, and I'm the coordinator for the Health First Center and Mobile Wellness at Catawba Valley Health System. In 2017, we found out that the mannequins that we currently were using for CPR were not going to meet the new guidelines as set forth by the American Heart Association. In 2018, we approached the foundation to assist us with this unexpected request. Through your generous support and funding, we were able to purchase several new mannequins that provided instant feedback for the participants of all of our classes. Our participants include employees with our corporate partners and many community organizations that we partner with, including employees that we work very closely with through our medical group. This is just one of the many educational opportunities available through the Health First Center. Besides our CPR training, the Health First Center offers numerous programs related to health and wellness as we look at population health management and making the community members that live here healthier and happier.
Hello, my name is Adina Andrew. I'm the Chief Nursing Officer, and we are here in one of our patient rooms next to a patient recliner. I think many people would be very surprised to know that one of the most essential and evidence-based interventions that we perform for our patients is progressive mobilization. It is astounding to read the literature and find out how quickly muscles begin to atrophy once patients are hospitalized and placed in a bed, resulting often in patients leaving the hospital in worse physical condition than when they arrived. Here at Catawba Valley Health System, we are committed to progressive mobilization for our patients. This requires getting patients out of bed and into a recliner for all of their meals as soon as they are able. We then ask patients to spend more time in the recliner than in the bed, eventually progressing them to walking in their room and then out into the hallway. Not only is this an essential piece of equipment for our patients, but also for family members who spend long periods of time with their loved ones, it can be a place for them to get some rest. The result is that the humble recliner is the workhorse in a patient's room, often resulting in the need for repair and replacement. Thank you to all the members of the Foundation for purchasing additional recliners for our patient rooms. It is allowing us to provide evidence-based patient care that is required and deserved by our patients. We are continuously grateful for your generosity. Thank you.
On behalf of Catawba Valley Health System, please accept my heartfelt thanks for your support through the Catawba Medical Foundation. The support we receive from partners like you makes a huge difference in our ability to care for our community. We are committed to being good stewards of the gifts received. Your giving spirit is greatly appreciated. Again, thank you.